Our topic is on anti-abortion laws, which is a political topic rooted from an ongoing ethical dilemma. There is currently no federal mandate on the regulation of abortions. Accessibility to abortions is enforced on a state-to-state basis. There are only 7 states in the United States that do not have some type of anti-abortion law in place, one being New Jersey. The anti-abortion laws in each state vary based on who is able to perform the abortion, the gestational period of when an abortion can be obtained, waiting periods, and health and insurance coverages. 43 states prohibit abortions after a certain time period. The chart on the left shows the requirements in each state. The medium tan color is between 22 to 24 weeks of gestation, which is the most common time period among our states. 25 states require a waiting time between consulting about an abortion and actually obtaining one. It is usually about 24 hours. 12 states restrict abortion coverage in private insurance plans, with most having the exception that it would be covered if the mother's life is at risk if they were to carry to full term. Most of these states do allow the purchase of additional abortion coverages separate for an extra cost. This fuels a larger debate on abortion funding and health reform policies. Those who support anti-abortion laws believe that an abortion should not be paid for with state or federal funding. As of now, there are 16 states that fund medically required abortion through Medicaid, while 33 states and Washington, D.C. forbid the use of state tax dollars to fund abortions. Funding on a federal level requires the woman's life to be in danger or the pregnancy to be a result of rape or incest. There are typically 2 sides to this controversial debate: pro-life and pro-choice. Those who are pro-life tend to support anti-abortion laws and believe that the life of the unborn child should be of the utmost importance. Those who are pro-choice tend to believe that anti-abortion laws are unconstitutional because it should be up to the woman what to do with her own body. In 1973, the Supreme Court case of Roe v. Wade became the landmark case of abortion in America. The court ruled in favor of Jane Roe and ruled that it was her constitutional right to obtain an abortion. This set the precedent on a federal level for many cases that came afterwards in regard to a woman's right to choose. The judge in this case also set a trimester framework, claiming that a fetus is not considered viable until the 3rd trimester, and therefore, before then, it is up to the woman. 2 years after the passing of Roe v. Wade, Illinois passed the Illinois Abortion Act. Unlike Roe v. Wade, this law deems that from the point of conception, a woman is carrying an unborn child. This law focused on the rights of the child and only allowed a woman to legally obtain an abortion if the mother's life was at risk. The law was deemed unconstitutional because of the Roe v. Wade ruling, but a clause in the act stated if Roe v. Wade were to ever be overturned, this law could be reenacted. Only 4 years ago, in 2018, a bill was signed into law that eliminated this law for good. This video is full of testimonials from women who had to experience life before Roe v. Wade and all of the things they had to endure and witness.
When you have chronic kidney disease, there are places you'd like to be, like here.
He said, I'm not going to give you any anesthetic. And he said, if you scream, they will hear you.
I woke up to feeling a man's hand on my throat and saying, if you make a sound, I'll kill you.
You know, there were a lot of years in there of heavy drinking, and I wasn't even responsible for myself. I never would have been responsible for a child.
I just was in the position that every woman knows, on the table with my legs spread apart, and this man is inside me, scooping me out as if I were a piece of fruit or something with this implement.
I could not believe that I was seeing this. I just went home and cried. Someone gave her a hanger abortion, perforated her uterus and her bowel. And by the time she came to the hospital, She was in septic shock and she died.
They said, look, if you're pregnant and you want an abortion, this is the process. And I would have to basically say that I will commit suicide if I do not have this procedure. I said, I do not want this baby. It turns out that, in fact, the hospital would not do the procedure, and so I had to look for an abortionist.
When I tell this story, I always refer to myself as a daughter of privilege because I was very lucky. My father was a doctor. He made the arrangements once I made the decision.
The pain was so outrageous that I do remember leaving my body. I didn't scream, but I do remember it was the feeling that I was up out of my body looking down on it.
I drove up with a friend to upstate Louisiana and had an abortion. He was an MD. The doctor had said, you'll be in some pain, but it'll go away. The third day, I was still in a lot of pain. In fact, I was in more pain.
The second woman, a young woman who was really my age, who was the mother of 2 little children, and the family could not afford a third child, so she had an abortion. And within 48 hours, she died of tetanus.
My father drove me there. He was very afraid that he would be fired if they knew that he was involved in something like this. When we went to the appointment, he took all of his identification out of his pocket and left him at home. I was actually given a cover story. I think he was as scared as I was.
It had been a very bad abortion. The doctor had actually left in tissue that had, I guess putrefied may be the right word, and had caused massive infection in this whole area of my body. Peritonitis, it's called. And I was in the hospital for 2 weeks. The doctor said basically I was 7 hours away from death. He did a complete DNC. He came after the procedure was done and said, I am so sorry, Jane. I had to report this to the police.
My father parked underneath the expressway and it was dark and there was a street light. I remember as I was walking in, I looked back. He was sitting in the car under the street light trying to read the newspaper. And that just gets me every time because we weren't really that close. But yet he came through for me at that time.
After he had finished, he showed me, here's what I took out of you. He said, you must not let any boys touch you. It's very important that you keep yourself pure. And at that point, he started to molest me. And all this time, of course, I've got blood coming out of me. I can't make a sound. I can't call out. I can't do anything.
The police came to the hospital and they wanted to know who had done it. Well, he did almost kill me, so I want to give his name to them on the one hand. And on the other hand, I believed in abortion. And I didn't want to see this doctor arrested. He was doing me a favor.
Because of the stigma, a lot of them were afraid to go to the ER. And so they just bled out. So that was the third person I saw who died of abortion in that short period of time in one little hospital in the middle of Brooklyn. And it made me think that there must have been a lot more than anybody ever said there was.
Being raped was pretty bad, but having an abortion was shameful. The period of time that this was happening, you did not want anybody to know that you were doing this.
I've regretted not having children, but I still don't regret having the abortion because I don't think one has anything to do with the other.
I couldn't get pregnant, and that in part was probably related to a lot of scar tissue from that peritonitis.
At this point, it's extremely safe. In 2012, there was a total of 4 abortion-related deaths in the United States.
If we don't guard very preciously, and fiercely, the right to have an abortion, this is what it's going to be like again.
It always stuck with me of how lucky I was to be able to make my own decision and have somebody help me.
The abortions will continue regardless of whether it's legal or not legal, as it always has. This is like 50 years later. It seems almost like yesterday. I could still see their faces.
if abortion doesn't continue to be legal, women will lose their lives. Women will have abortions. Women were having abortions when they were illegal, and women died, and I almost died.
It's just really important today to make sure that people understand how important it is to have your options.
I feel more strongly than ever the older I get. We can't lose this right.
With anti-abortion laws and regulations constantly changing, it seems that healthcare professionals are the ones dealt with some of the most difficult tasks. Nurses face many ethical dilemmas because of anti-abortion laws, especially in the state of Texas. It is a nurse's job to advocate for their patients, and that is not possible in Texas. Nurses are also at risk for potential lawsuits, losing their job, and even jail time if they aid in the process of a woman obtaining an abortion. The ethical principles to consider when thinking about nurses and anti-abortion laws are autonomy, beneficence, and non-maleficence. The autonomy of a patient is at risk because a patient should always be entitled to make decisions about their own health care. It goes against patient autonomy to either convince a patient that an abortion is not the way to go or to not support them in their decision. Anti-abortion laws essentially make nurses choose. Beneficence is another key ethical principle to consider. It means to do good for our patients. When a woman is unable to receive safe and accessible medical care, her health could be at risk and lead to injuries, infections, or even death. When considering non-maleficence, meaning to do no harm to a patient, anti-abortion laws are unethical because forcing a woman to give birth may lead to severe psychological trauma, especially if the child was a product of incest or rape. There are both pros and cons of anti-abortion laws. The benefits of anti-abortion laws include ensuring the right to life, depending on your belief of when life begins, decreased risk for potential medical problems in the future, and anti-abortion laws consider the father's rights too. The cons of anti-abortion laws are that they take away women's rights to decide what to do with their own body. They lead to potential health risks, including mental trauma and unsafe abortion practices. Another con is that many women choose to have an abortion because they find that the fetus may have a fatal disease, and anti-abortion laws lead to children being born with fatal diseases or not even being born at all. Failed abortions cause 8 to 11% of maternal deaths annually in countries with anti-abortion laws. Women are forced to exercise unsafe abortion practices, which include using sharp objects and harmful chemicals that can lead to injury of internal organs. In states and countries with anti-abortion laws, women put themselves at risk all the time trying to preserve their autonomy. In Texas, because of the heartbeat bill, any woman who obtains an abortion or anyone who aids in the process can be sued. This includes doctors, nurses, friends, family, and even an Uber driver who may drop her off. In multiple countries, including El Salvador and the Dominican Republic, women can face jail time for abortions and can even be faced with homicide charges on top of abortion charges. As nurses, it is our responsibility to advocate for our patients and to support their decision no matter what it may be. We may not always agree with what they choose to do, but at the end of the day, it is their decision to make and our job to help them through it.